For those of you who are just joining the live stream, a warm welcome from Geneva, Switzerland. I'm Rida Sadki. We'll be starting. We'll give everyone a couple of minutes to join the live stream. We're currently streaming on LinkedIn. So if you're on LinkedIn, leave us a comment, leave us a message so we know that you're there. And we are speaking with Susan MacKay from GAVI. Let me cue this up. Let me correct this. Here we go. And she works at GAVI specifically on this topic that has been keeping us busy, thinking about vaccine hesitancy, demand promotion, community engagement, and is of course involved in the global effort to get the COVID-19 vaccines ready for introduction across the world. I believe GAVI, the Vaccine Alliance, has announced that 2 billion doses should be made available by the end of 2021. A warm welcome to you, Susan.
Thanks for.
All right, and we'll be
delighted to be here.
Great, and we're here in the room with 105 currently members of the COVID-19 Peer Hub who've just completed case studies on vaccine hesitancy, who are right now peer reviewing them, and many of whom are involved and certainly thinking about what that COVID-19 vaccine introduction is going to look like. So we're going to do a short Q&A with Susan, and so we'll give everyone about a minute to get online and get on the live stream. Remember, we're looking at your comments and questions. Don't just say hello and tell us where you're from, but actually you can ask the questions you have about COVID-19 vaccine introduction and specifically Susan's area of specialty, which is around vaccine hesitancy, demand promotion, and community engagement. See you in a minute. All right, welcome. I'm Rida Sadki from the Geneva Learning Foundation. Thank you for joining us on this impromptu live stream. This was not planned, but that's just the way the world works, is when there is a need, when we're able to welcome Susan MacKay from GAVI, from the Vaccine Alliance. We just finished a 1 hour long workshop working with national and subnational immunization staff from all over the world. We heard contributions from Nigeria, India, Ghana, Iraq, Ethiopia, Cameroon, and Uganda. Presenters shared wherever they sit in the health system, from the district, the health facility, or at the national level, how they are thinking about COVID-19 vaccine introduction, and especially this question: what do you expect to face with respect to vaccine hesitancy, demand promotion, and community engagement? How are you preparing to face this? So, of course, this discussion was private, but we're super pleased to have Susan MacKay stay with us now for a few minutes to answer some questions. We'll look for participant questions in the chat, questions on the live stream, and we're going to start with Charlotte and Boo's questions. She always has really good, meaty questions. Charlotte, over to you.
Thank you very much, Rida, and welcome to you, Susan. It's a pleasure to have you join us for today's impromptu live chat. So my first question to you is, what is GAVI's role in the COVID-19 vaccine rollout? You know, GAVI, the Vaccine Alliance, if you can say in just a few words.
Well, I think GAVI has been able to play quite a central role. I think many of you are aware of the establishing of the COVAX facility, and GAVI has stepped up to essentially make sure that vaccines are available to countries all around the world, and working very hard to make sure that this is a fair and transparent and process, so that it's not just going to be a question of vaccines going first to the richest countries. So I think we're very excited to be contributing to that goal.
In fact, Susan, the very first question from Okello Ogwal Hillary via Facebook is, why is planning COVID-19 vaccine introduction not started in other countries? Obviously, the headline has been about the first individuals receiving a COVID-19 vaccine in the United Kingdom. So that brings up the equity. What can you say? What's GAVI's position?
Well, planning is very much underway, and I think as soon as the plans became clear, that I know that all the alliance partners have been working really closely with countries to essentially this unprecedented vaccine introduction. And I think, as everybody that was in the last hour knows, there are many things that go into paving the way for that very first vaccine to arrive. And I think this is vaccines that have been developed at unprecedented speed and scale. So it's extremely exciting that the countries that were on the call today will be very soon actually receiving the very first vaccines to these countries. And as in years past, of course, it was literally years, if not decades, before some of the new and underutilized vaccines came in. So I think this is very much a global first.
Thank you, Susan. Back to you, Charlotte. What is your next question for Susan MacKay from GAVI?
Thank you, Susan, and thank you too, Reda. Just to say that I think the previous question was quite in line with the question I wanted to ask Susan, because we know GAVI has some countries of focus. In previous years, there are some countries of focus. So I was just wondering if with COVID-19, you're going to move from maybe the countries in which GAVI used to focus their activities to having a more global view, talking about equity, just like Reda mentioned a while ago.
Yes, and actually the COVAX facility has been made open to all, and countries were invited to become part of this global effort to procure and distribute vaccines in a more equitable fashion. So yes, it has meant that GAVI is working with countries that we don't normally work with, but I think that's bringing the world together in an exciting way.
Yeah, exactly. Thank you. My next question, so many of the experiences that we listened to a while ago, when it came to challenges, the main challenge that kept coming up was hesitancy, vaccine hesitancy. So I was wondering, is GAVI with other global partners actually working towards developing guidelines or new strategies on how to better communicate as far as rolling out the COVID vaccine is concerned?
Yeah, absolutely. Our partners, and led by UNICEF and WHO, but also CDC and many other organizations have been involved, and members of civil society as well. We have a demand working group who have been specifically working on guidance to get out to countries as quickly as possible, because we know that if we are to successfully roll out this vaccine to health workers as well as to the public, we will need to have trust and confidence in this vaccine introduction. So a lot has been happening behind the scenes, and there are many new aspects that we need to take care of. It's a vaccine that's going first to frontline workers and also high-risk populations. So this is not the usual work that we're doing for immunizing infants. So there are many aspects to take care of. But as I say, and also this is unusual in that normally when we're working in immunization, we're working with tried and tested vaccines that have a lot of years of experience. But whilst these vaccines, every effort has gone into ensuring that these vaccines are safe and have been properly tested. But obviously there are many unknown factors which does make this more challenging in this case. But I think, as you've already seen, that all the best procedures have been followed in this case, so that there's a high level of confidence in the vaccines that are being rolled out.
So, Susan, I see in the room with us we have people whose daily work is immunization from all levels of the health system in many different countries. And many of the questions I'm seeing in the chat are asking about the characteristics of the COVID-19 vaccines. You've already said before we went live, it's complicated. Can you tell us how currently someone who works in immunization, who's maybe is a little bit ahead of the game, whatever level they work at, because they're participating in the peer hub, they're hearing about this before the news reaches them by other channels. What would be your advice on how they can get reliable, technically accurate information to answer those questions about the vaccines themselves?
Yeah, I think, and obviously, I think for those in the health system, that it really is about listening and keeping in touch with your colleagues in the national immunization programs who have the latest, most up-to-date information, who are working with all the experts, and to make sure that's where credible information is going to come from. We're certainly, all the partners are working with the media to make sure that what is being communicated through the media is accurately reported, because it's absolutely vital. There's a lot of conversation out there. I don't think we've ever seen so much conversation about immunization and vaccines. But I think it's extremely important that people make sure that what they're listening to is coming from a credible source, that it's the most up-to-date information, and that if they have any concerns, that they ask questions and make sure that they are satisfied by the answers, because it's going to be extremely important with many different vaccines being introduced. That obviously it's not just about the information that's out there; it's making sure that you have the right information relating to the vaccine that will actually be coming to your country.
I know Charlotte has many questions. We've got one from Adamu Abubakar from Nigeria, who says, who just gets to the point. How are GAVI and other partners going to help us to move from vaccine hesitancy to acceptance? Let me put the question up.
Yes, absolutely. I think the vaccines are, by the vast majority of people, widely accepted as a social norm. The people understand the value of vaccines, and also the systems that go into developing them, regulating them, and delivering them. And it's one of those things. It's a bit like the airline industry, that there is a huge amount of effort, and that's the absolute primary concern. So it's that I think people are working day and night to make sure that this is a smooth introduction, because of obviously the situation that we're in. But the partners, I think, I'm actually impressed by how much information is being made available, open and transparent, and that we are equipping frontline workers with the right information and the right skills and the right confidence to be able to reassure people that this is a very necessary exercise. And I think, if we've seen many of the people who've started to receive the vaccines, that there is a great sense of relief that we might be turning a corner, that the world has stepped up to this challenge, and that this is the start of helping to move forward from the pandemic.
Great. Thank you, Susan. And back to you, Charlotte. I also see many questions from members of the Peer Hub in the chat. I hope you can synthesize that all.
And I just wanted to, they constantly, members of the Peer Hub are asking about the affordability of the vaccine for poor countries. And I just wanted to pick out this question from Salu Shifero from Ethiopia. He said, is cost affordable for poor countries, including operational and as well as co-financing, as the vaccine is given for large target groups?
Yes, absolutely. A huge amount of effort has gone into making sure that this vaccine is affordable. And obviously that work is ongoing, and working through the GAVI mechanisms for the GAVI eligible countries. And so that was the primary concern, is that through the approach and the support of donors, that the vaccine needs to be rolled out worldwide, because the only way to keep the whole world safe is to make sure that the vaccine is available to all countries.
There's a very good question via Facebook from Aisiatou Laren, because Susan MacKay from GAVI, her specific area of expertise is around demand promotion. And Aisiatou Laren says, thanks for this workshop. What measures are being taken to protect and reassure populations, especially in sub-Saharan African countries that historically have been marginalized and are now generally distrustful of vaccines, according to Aisiatou?
So I think that the important thing to say is that in all parts of the world, there is, in terms of vaccines, there are almost 9 out of 10 children is actually vaccinated in the world. So it's really important to say that vaccines and immunization are widely accepted. But we do know that that there are concerns, particularly spreading on social media, that have become quite well reported, and there can be localized concerns around immunization. But there's every effort is underway to make sure that the relationship between health systems and communities is strong, that that health workers have the right information, that they're able to reassure parents. And obviously, I think the success of immunization globally also speaks for itself. So I think it's important. I think so important to focus on the positives and the widespread uptake and the success of the programs that do keep our children and adults safe day in, day out.
Thanks, Susan. The sheer number of questions shows to me that there's this kind of dialogue is something that will need to, extend beyond the 20 minutes that we're going to spend with Susan today. So back to you, Charlotte, for perhaps a final 1 or 2 questions, knowing that this is really hopefully the start of a conversation. And thank you, Susan MacKay, again from GAVI, from the Vaccine Alliance, for being willing to engage with this group of immunization staff, national, subnational, from all levels of the system, who are already thinking about COVID-19 vaccine introduction. Back to you, Charlotte.
Thank you, Reda. And just to say that still lots and lots of questions on the chat that we won't have time to look at, Susan. But there is one that keeps coming up, and I just wanted to pass it by you this afternoon. It has to do with the vaccine being rolled out. Would it be preferably a routine immunization or as campaign, or each country will adapt as per the various conditions available for them?
So obviously, at the start of this introduction, as we know, that there are only limited quantities available, and countries are working hard to make sure those at highest risk, whether it be by their profession or by perhaps some of the either their age or health condition, will receive the vaccine. And so obviously these kind of introductions initially will be under a kind of campaign approach. But the answer is we don't yet know everything about these vaccines in terms of how long that they will give protection. We're obviously trying to get them to as many people as possible and ramping up production. But in terms of whether this will move over from being a campaign introduction into becoming a vaccine, more like a flu vaccine that, for example, that may either go into a routine program and may need to be repeated over time. These are questions that are still being worked out. So I think it's important that everyone on this call and in this group keeps abreast of the latest developments, because it is obviously a very dynamic and exciting space in terms of how everything is developing.
Right. Thank you, Susan. Charlotte,
thank you very
final
much,
question?
Susan. Yes, I just wanted one final question.
I know there's one more.
Just thinking about an opposite scenario, Reda, in which that is the demand for the vaccine is so higher than the ability to supply. What kind of communication will be made available to ensure that people don't maybe get out of control, that are patient enough to wait?
Yeah, no, this is a very important question, because in fact, with many vaccines, and when we've seen outbreaks, for example, of meningitis or yellow fever, or in the cases of HPV, for example, where shortages of supply have meant that we've not been able to meet the demand for vaccines. And I think, if anything, working in the demand space, that the lack of supply can be as challenging as having too much supply, so and not enough people to take it. So I think what we're saying here is that building trust with health workers and with communities is absolutely at the center. That you need to communicate the right information at the right time to the right people, and also be honest, because whether being honest about the decisions that go into making who gets the vaccine first is absolutely vital, so that people understand the priorities and are respectful, because I think underlying everything, in terms of immunization, is having trust in our governments, having trust in our health system in order. That's the foundation on which immunization is built. And so communication, being open, honest, and transparent is something that the health system really needs to focus on and get right.
Thank you very much, Susan.
And thank you, Charlotte. Charlotte Mbou and myself, Reda Sadki from the Geneva Learning Foundation. Thank you for having joined this impromptu live stream. Thank you, Susan MacKay from GAVI, for having joined as well. For Adamu Abubakar, who says, how are we going to get all the discussion? Well, stay tuned. Wherever you found us on Facebook, keep an eye on our Facebook page. You'll see more coming and more invitations to workshops like this one. We're hoping this is just the beginning, and we're hoping that the Peer Hub members who've been working together, connecting more than 6,000 people from 90 countries, immunization staff from all levels of the system, that what you are, the experience that you have now of working together in these digitally connected ways can contribute to the challenge before us, which is to successfully introduce and scale up these vaccines to protect individuals and populations from the COVID-19, from the coronavirus. Thank you, Subhadip. And let's end with a round of applause for the immunization staff who, if they're not already getting ready to introduce COVID-19 vaccine, are soon going to be asked to do so by their ministries of health. Thank you, and see you soon. Keep an eye on our Facebook page. We'll now do a quick rewind of all the messages, or some of the messages received today. Thank you, and goodbye. Yes, for Grace Vichy, we were not able to answer really technical questions about the vaccine. That is not Susan MacKay's specialized expertise. So even if she knows the answer, it would not be appropriate to ask her a question. But we will be continuing this dialogue so that you can find yourself the information for yourself and ask your Ministry of Health and receive the answers and support that you need. Bonjour à Taïrou Maradoum et à bientôt.